when you see cases, 10 to 14 days after that, those become hospitalizations.
ICUs buckling under pressure in Ontario, a P1 variant spreading rapidly in BC, but the highest rate of active cases in the country isn't in either province. It's here in Alberta, and doctors warn those numbers can translate into more dire figures. Hospitalizations, deaths, the kind of numbers no one wants to compete with. Dr. Gabriel Fabro is dreading his next rotation at the Peter Lougheed Centre in Calgary, as Alberta surpassed 20,000 active cases.
It's about to get really, really bad, and it's frustrating that it didn't have to be that way, and that the cases still rise, and we know that just means that things are going to get really awful very soon.
Health Canada data says Ontario has an active case rate of 277 cases per 100,000 people, compared to Alberta at 455 cases and BC at 176 per 100,000. Dr. Fabro points to an Ontario science table finding that says shifting vaccines to hotspots will help reduce hospitalizations and deaths.
The concepts are, if you're at higher risk and your house is on fire, that's where we send you the firefighters. Pop-up clinics that work in Surrey, that are working in Ontario, that are working in Peel, they need to be deployed to places like Upper Northeast Calgary, Millwoods and Edmonton, Northeast Edmonton, Fort McMurray.
Politicians in the COVID hotspot of Fort McMurray declaring a local state of emergency for the region during a late-night meeting Sunday. And vaccines won't offer a quick way out. A recent Angus Reid Institute poll says 28% of Albertans feel unsure or will not get a shot, compared to the national average of 16%.
And even after receiving a first dose, it takes about 2 weeks before you reach a significant degree of immunity. So no matter what happens, we are going to see a lot of hospitalizations, a lot of critically ill folks, and we're going to see more deaths.
In Calgary, Crystal Ladaris, City News.